Hey, what's up, guys? My name is Christopher Morley, and I recently submitted this idea called Documentor to you over at Blueprint. And I guess the purpose of this video is to elaborate on that idea a little bit further. So that's kind of what I want to do. So I just finished work today. It's about 6:30 on Friday. I've just been sitting in the hospital for about 12 hours. I've been sitting in this room. This is called the documentation room, one on each floor. And you could say it's just a room full of computers. During the day, there would be probably 5, 6 other doctors in here. About 5, 6 hours a day out of 12 hours, so about 50% of our day is sitting in this room. And all we're trying to do is type and document all the information that's going on out on the medical floor, right? We're trying to capture the conversations that are had, all the data, all the metrics, all the rationale, all the decision-making process, substantiate that, and then that information is then given to the medical coding department, and they turn all of our pros and all that data into 5-digit numbers, right? Which then they can send for reimbursements, as well as epidemiological evidence and just quality control purposes, right? A vast range. Everything is based on the ICD codes, except documentation. Documentation by the doctors is not based on these codes at all. There's an incredible middle process of the medical coders, clinical documentation nurses. For example, today, I kept track today, I was paged 6 times by documentation nurses who read my notes and then query me about what I wrote and ask me to change semantics, change wording, consider certain things that they could then capture, turn that into a code, and then get more money for it. And I think there's incredible opportunity there to skip that process, right? As you can see, there's, I'll show you guys right now. So, right in front of you, right here, is some posters that are supposed to help us with documentation, to help the entire department capture what's going on the medical floors and turn that into codes in a more efficient, accurate way, so we could have better documentation. However, this is just not the way to go about it, right? So their purpose, or what they're trying to suggest, is that we can no longer just say things like asthma, right? You have to specify if the asthma is intermittent, persistent, mild, moderate, severe. These need to be quantified based on data. How many times do they wake up at night? Right? How many inhalers are they on? How many times have they been hospital? How many times have they been intubated? There's systematic ways that the data needs to be collected. However, as doctors, they don't teach you that, right? They don't teach you in medical school how to document things, not at all. They teach you, they don't teach you how to optimize for reimbursements. And recently, I have it right here in front of me. On, what is this, April 9th, 2014, Medicare recently released the reimbursement rates by doctors. You could search by specialty and zip code. So out of curiosity, I put in some of the attending doctors that I'm working with, and I'm familiar with them. I am with them every other day. And you would be surprised at the reimbursement rates between the same doctors doing the same things, because one doctor knows how to document, right? He's understood these posters that the clinical documentation improvement program has instilled here, and they've kind of internalized that, and now they're great at documentation. They're able to really they know the word. It's literally down to semantics and word choice. It's that nitty gritty, okay? And so I'm looking at this, and I see some guys that I'm working with are being reimbursed by Medicare $200,000. And then I scroll down, and the same guy that I work with, a different guy, but same field, same exact job, is being reimbursed by Medicare $50,000. A quarter of the reimbursements, because that guy doesn't know how to document properly. And I don't know, I just think that problem is absolutely amazing to me, and I think it's going to get substantially worse for a number of reasons. So there's an incredible range of problems here. One of the first ones, the ICD-9 currently has 14,000 diagnoses in it, right? So we're struggling to keep up with the documentation and being able to capture these clinical care snippets here and there and turn them into codes, and there's only 14,000 of them. ICD-10 comes out soon, as you guys are probably aware. It has 68,000 diagnoses in it and 87,000 procedures. So the specificity that's about to be required by doctors' documentation in order to turn that into proper codes to maximize quality control, to maximize reimbursements, is about to increase exponentially by literally a factor of 5 or 10. And I'm spending 6 out of 12 hours sitting at the computer trying to do my best to kind of learn documentation on the fly based on these posters that I have in front of me. That makes no sense to me at all. I think there's a much better solution here. I think it has to come down to creating templates that are optimized for example, I have 10 patients right now. 3 of them have COPD exacerbation. Right? I should have a program that is already a template of some kind that is already predetermined for me, that I should be looking for. The metrics that the billing departments, the insurance companies are interested in should be they should prompt me, right? How much oxygen does this guy require? What do his ABG and all of his labs look like? What information do I need to put into the computer in order to transform that into maximizing the codes for reimbursement rates, and for the sake of accuracy, and for all the epidemiological evidence that is totally dependent on these codes as well. I talk to a lot of my colleagues, and it's totally understandable why 50% of doctors don't go into medicine anymore, or wouldn't recommend medicine to their own children. And I think the main reason is documentation. It's huge. It's an enormous problem, and I think there's I'm just kind of learning this on the fly, and I've done some reading, but I certainly have much more to go. I know enough about this at this point to know how much I don't know, which is exciting. It's exciting to me to learn more about it, and so yeah, I would love to talk to you guys more about this. I have so many ideas. I see I'm already at 7 minutes. You asked for a 3-minute video, and I'm not even close. But I didn't even touch on half the things that we're talking about here. So I'd love to talk to you guys further. Please let me know what you think. Thanks. Bye.